So, good day everyone, especially to our instructor Mamian. So, by the way, I am Maton Johani. So, our topic is about tube feeding. So, enteral feeding means enteral feeding is giving nutrition directly into the stomach or intestine using a feeding tube. So, ginagamit ito kapag hindi makakain ng pasyente sa bibig pero gumagana ang GI tract niya. So, types of enteral feeding naman is, the first one is nasogastric tube. So, ang tube na ipinapasok sa ilong papunta sa tiyan. So, example is stroke. So, the stroke patient na hindi makalunok pero gumagana ang kanyang tiyan. So, the second is orogastric tube. So, tube na ipinapasok sa bibig papunta sa tiyan. So, example is infant na hindi pa marunong mag-swallow ng maayos. So, third is gastrostomy, G-tube. Direktang tube na sa tiyan sa pamamagitan ng maliit na operasyon. So, example is long-term feeding sa pasyente na may throat cancer. So, the last is jejunostomy, G-tube. Tube na diretso sa jejunum, parte ng maliit ng bituka. Example is pasyente na may severe gastric problem. So, sa indication naman is kailan ginagamit? Ginagamit kapag hindi makakain o makalunok ang pasyente, kapag ito ay may stroke o coma, may swallowing difficulty, may severe malnutrition, may neurological disorder. So, example is isang pasyente na coma dahil sa accident pero gumagana ang bitoka. So, sa enteral feeding naman, sa enteral feeding ang gagamitin, so, sa contraindication, kung kailan hindi ginagamit kapag hindi gumagana ang GI tract, may intestinal obstruction, may severe vomiting or diarrhea. So, example is pasyente na may bowel obstruction, hindi pwede ang enteral feeding. So, sa complication and problems is aspiration, napupunta ang pagkain sa baga. So, tulad ng diarrhea, constipation, nausea at vomiting, tube blockage. So, example is kapag masyadong mabilis ang feeding, maaring magsuka ang pasyente. So, sa types of enteral formulas naman is first is intact formula or polymeric. So, meaning ang buong protein, fats at carbohydrates, kailangan normal ang digestion. So example is Ensure Standard Hospital Feeding Formula. So, ginagamit sa pasyente na normal ang digestion pero hindi makakain. So, sa hydrolyzed formula is elemental o semi-elemental, meaning ang nutrients ay naka-breakdowns na para mas madaling ma-observe. So, example is pasyente na may mala-absorption or severe diarrhea. So, sa modular formula is meaning isang specific nutrient lang ang dinagdagdag. So, protein lang or carbohydrates or fats. So, example is burn patient na kailangan ng extra protein. So, dadagdagan ng protein powder. So, lagi nating tatandaan na kung gumagana ang bituka is tinatawag na enteral feeding. So, kapag naman hindi gumagana ang bituka is tinatawag na parenteral feeding ang gagamitin. So, sa intact naman is normal digestion. So, sa hydrolyze naman is madaling tunawin. So, the last is modular, dadagdag ng specific nutrients. So, that's all. Thank you.
Hi everyone, my name is Siliha Aisubu. So my assigned topic is about feeding administration and parenteral feeding. So first, feeding administration refers to the different ways of giving nutrition to patients who cannot eat normally. So first method of feeding administration is continuous drip. Continuous drips giving slowly over many hours using a pump, best for very sick patients, lower risk of nausea and aspiration. So, example is a patient in ICU who cannot swallow is feed slowly for 24 hours. So, second one is um, bolus feeding. So, bolus feedings is giving largest amount at a set time like meals. So and giving use a siren. So example is steval patient with a nasogastric tube is lead every 4 hours. So third one is continuous feeding. So continuous feeding use both continuous and bolus method. So example, continuous feeding at night but feeding during the day. My second topic is parenteral feeding or parenteral nutrition. Parenteral feeding is giving nutrition directly into the bloodstream through an IV line. It is also called total parenteral nutrition. Indication when it is used when the digestive system is not working, serve intentional problems after major GI surgery, severe malnutrition. Contraindication when it should not be used. If the tract is working normally, hemodynamically unstable patients, severe metabolic imbalance not yet correct. Remember, if the gut is working and feedings is preferred. So complication and problems, infection, high or low blood sugar, electrolyte imbalance. So example is a patient on TPN develop high blood sugar. That's all. Thank you.